Hello, my name is Dr. Jason Pear. I'm a clinical instructor at the UCLA section of orthodontics, also a private practitioner in Northridge and Calabasas, California. This is actually a transfer case, and these photographs were taken 2.5 years before I met the patient. They were the initial starting photographs in another office. You can appreciate she has a straight profile with well-balanced facial thirds, slightly asymmetric with the chin to the left, and she's got a narrow upper arch when she smiles, but with a normal display of gum tissue. Here we can see the intraoral photographs from 2.5 years before I met the patient. You can appreciate the class 2 malocclusion in the molar positions, blocked out upper cuspids, mild lower crowding, and a narrow maxillary arch. At this point, they'd moved forward with non-extraction treatment, and it was 2.5 years later that she came to me for a second opinion before the braces came off. Here we have the initial facial photographs from the first time I met the patient. You can appreciate relative to her initial profile 2.5 years ago, she's more dolichofacial, more convex. She also has more lip incompetence. But you can also appreciate the chief complaint of the patients, and that was the fact that she was very gummy in her smile, and the parents were concerned that the braces were going to be removed before this was addressed. Here we can see the initial photographs, intraoral photographs taken at the initial exam in my office, and you can appreciate a nice class 1 occlusion with normal overjet and overbite, well-lined arches, with the exception of second molars, which had not yet been bracketed. At this point, I also asked the patient about mouth breathing issues that I noticed during the initial exam, and in fact, they'd said that she had years of mouth breathing and in fact had recently seen an ENT upon the recommendation of a pediatrician. And the ENT had mentioned that her adenoids and tonsils should probably be removed. The parents had no inkling that this mouth breathing could have had any potential impact on the development of her malocclusion up until this point. The initial panoramic radiograph demonstrates fairly well-aligned arches, reasonable root parallelism except for the lower second and first molars, and reasonable bone around all the teeth. Here we have her initial lateral ceph from my office, and you can appreciate the fact that she's got class 2 skeletal relationship, as well as dentally she's within normal limits for the upper and lower teeth, although the upper incisors could use some more labial crown torque. The lower lip E-line, it's ahead of the norm, and you can appreciate that when you see her profile as well, with the lower lip hanging forward with her lip incompetence. So at this point, we gave the patient really 2 options. We initially said they should follow through with the ENT and have the adenoids and tonsils removed, as they had recommended. But then the other orthodontic options we gave was 1, debond and wait for growth to be completed, followed by jaw surgery to manage the gummy smile. Or 2, start initial posterior intrusion of the maxillary arch with posterior TADs, and then once the posterior teeth had been intruded, go ahead and bond up the full upper arch and intrude the anterior teeth using nickel titanium wires. The anchorage, of course, had been established already with the posterior intrusion, so the anteriors would intrude to the level of the posterior teeth, and then finish up the occlusion that way, hopefully then achieving the minimization of the gummy smile while maintaining the current occlusion. Here you can see the post-retention photographs, and from it you can appreciate the fact that we were able to address the chief complaint, which is the gummy smile. They were very satisfied with that result. The face, despite being still slightly dolichofacial, is less so than the initial presentation in my office. The occlusion still maintained beautiful class 1 occlusion with normal overjet and overbite, and we're able to get the second molars aligned as well. If you'd like to know more about this case, please see the PCSO Bulletin 2023 winter issue, and I appreciate your kind attention.